Senior Dr. Sarah Whitelaw is heading to trauma to treat a critically injured cyclist who's been hit by a car and thrown from his bike.
1, 2, 3.
We see a number of people that unfortunately die from their accidents every year, and a cyclist just doesn't have a lot of protection, so often they can have dreadful injuries. My husband, 2 years ago now, was hit by a car while he was riding his bike to work and had a badly broken neck. It was broken in a way that if he moved it in the wrong way, that could cause an injury to the spinal cord that could have left him a quadriplegic. But fortunately, he's made almost a full recovery.
All right, get you out of all these wet clothes.
So when I hear that a cyclist has been hit by a four-wheel drive, that's a really high force. So from the top to their toes, they can have lots and lots of significant injuries.
This is Giuseppe. He's a 56-year-old male who's on a bike today cycling. He's been hit approximately 60 kilometres per hour from the rear. He doesn't remember being hit, he just remembers waking up in the gutter. He's got an obvious right humerus closed fracture. He's complaining of right lower back pain down into the groin. Some numbness and tingling bilateral feet.
Thank you so much. You guys have done a good job. I'm glad you put the pelvis on. That's good. So I'm Dr. Whitelaw. I'm Sarah. I'm one of the emergency doctors here. Welcome to the Royal Melbourne. A lot of force has been applied to Giuseppe's body. Then he's likely got thrown into the air and then hit the ground and stopped very suddenly. Where's most of your pain? Sorry? In your back, okay. You sore in your hips?
Yeah.
Sorry, mate. Can I get you to wiggle your toes for me?
I feel it. It's very numb.
They feel numb, do they? Okay. When people are having trouble feeling or moving their feet or their legs, we do worry about injuries both to the bones in their spine and also the nerves in the spinal cord itself, which can leave people permanently paralysed. So what we're going to do is roll you on your side, and we just need you to stay still. So don't shake or nod your head, just say yes or no when I'm pressing on the bones to tell me if they're sore or not.
Nice and slowly. 1, 2, 3. That's it. All right, try and relax down.
Is that sore up there where I'm pressing? That's painful?
Yes or no where the doctor's pushing. Any pain?
Yes.
Yes, down here?
Yes.
That's sore, okay.
All right, coming back. 1, 2, 3. And back. Give me some more. Very good. Very good.
Giuseppe's agonising pain is a big worry. An X-ray will give a better understanding of his injuries.
That looks a bit funny. Yeah, you'd have to worry that that's a significant pelvic injury.
Dr. Sarah now focuses on Giuseppe's broken pelvis, which could be fatal.
You can lose a lot of blood into a pelvic fracture.
Now, I've tried to ring the door desk, okay, but no one's answered.
Giuseppe's family is being contacted to let them know he's critically injured.
Giuseppe's X-ray is quite concerning. A broken pelvis can involve a huge amount of blood loss, and in fact, people can bleed to death quite quickly from a fractured pelvis that's injured the blood vessels in that area, so it's a really serious life-threatening injury.
1, 2, 3.
Dr. Sarah Whitelaw's patient, critically injured cyclist Giuseppe, was hit by a four-wheel drive.
Just some deep breaths.
What I'm particularly looking for in this CT is whether or not there's bleeding from one of the big blood vessels in the pelvis, because people can bleed to death quite quickly.
Please breathe in and hold your breath.
In a private family room, Giuseppe's daughter Eleanor and her mother Julie have just arrived.
On my way to see Dad, I was thinking of all the possible things that could have happened, but it wasn't until I got here that I realised how serious it was. And I think my heart just kind of dropped.
Oh, it's awful.
It is wide at the front and it's gone through the back.
The scans reveal Giuseppe has a broken collarbone and arm, severe damage to his spine, and his pelvis is broken on both sides.
We talked about there being lots of really big blood vessels down there, and the worry is, they can bleed very quickly. In this gentleman, it looks like they're not bleeding that quickly, so probably no huge blood vessels have been absolutely ripped in half.
Giuseppe is bleeding internally, and Dr. Sarah needs to stop it. But first, she must get his fractured arm out of immediate danger.
The worry is the position it's in at the moment is probably putting some stretch on the nerves and the blood vessels, so we've got to fix that reasonably quickly because it's limb-threatening.
The limb needs to be straightened, otherwise the tissue will die, and Giuseppe could lose the use of his arm.
Use a bit more of that ketamine. Just slow, deep breaths.
Dr. Sarah is watching for any change in Giuseppe's vital signs.
Sorry, mate.
If the blood pressure goes down and his pulse rate go up, then we worry about whether his bleeding has started to speed up, and then we will need to consider taking him to the operating theatre as a matter of absolute urgency. I know, my love, I know. You've done very well. It should be much more comfortable now.
As his arm is being wrapped in a plaster cast, suddenly there's a problem.
The blood pressure's gone down.
Vomit.
His blood pressure is dropping, and you need blood circulating to perfuse your brain and provide oxygen to your heart and your kidneys and your lungs. So once that bleeding gets to a point where there's not enough blood circulating around the body, Giuseppe could die unless we stop that bleeding.
Dr. Sarah's patient, Giuseppe, is in trouble. His blood pressure has plummeted.
Such a minute.
The 56-year-old may have internal bleeding that could put his life at risk.
Give him 250 mils of saline. He's got a bad pelvic fracture, so we need to make sure he's not bleeding. My sweet, I'm putting that cold jelly on your belly.
If the ultrasound shows signs of bleeding, Dr. Sarah will be forced to send Giuseppe for emergency surgery.
Giuseppe's blood pressure has just got very low, and we're aware that he's got the broken bone in his pelvis, and he's obviously had some impact here. So we want to look at all the potential causes of that low blood pressure. It might be pain, but I think in someone who has got lots of injuries, we want to make sure that he's not bleeding. All right, that looks pretty good.
Fortunately, no internal bleeding is found. But Giuseppe's injuries are still very serious.
Giuseppe will need a big operation to fix the bones in his pelvis and the bones in his lower back. Also an operation to fix the bones in his arm. But there's lots of possible complications associated with operations like that. Even if they go really well, he's got a lot of broken bones and it's going to be a long, hard recovery period for him.
It's a process Dr. Sarah went through with her husband 2 years ago. Now, she's about to break the news of Giuseppe's multiple injuries to his daughter Eleanor and her mum Julie.
At this stage, it looks like there's no big injuries in his chest, but it's really the pelvis and the lower back and the right arm.
So is it broken through?
Yeah. And it will need to go to the operating theatre. We'll give him lots and lots of pain relief, and he will be monitored in one of our very close observation areas, quite possibly our intensive care unit.
Okay, no worries. And when will we know for sure when the surgery is?
Yeah, I think that's a good question. At this stage, it will be scheduled for tomorrow.
Okay.
If things change, we will let you know.
Okay.
I definitely think that having personal experience of being a family member of someone who is badly injured has made me a better doctor.
Hey, Dad. Nice to meet you.
Oh, Jesus.
It's a lot for Eleanor to take in.
Dad is very sporty, very athletic. That's one of my biggest memories of Dad as a kid was always, cycling, mountain bike riding. I'm trying to put on a front because you need to be strong for your parents. But seeing your parent in that scenario was really, really confronting. Sorry.
Dr. Sarah's patient Giuseppe was rushed to hospital with life-threatening injuries after being hit by a four-wheel drive while cycling.
All right, try and relax now.
The architect was left with shocking injuries, including a badly broken pelvis, back, arm and collarbone.
That's the frame is broken.
But 3 months on from the accident, Giuseppe is recovering at home with his daughter Eleanor.
Big hit.
It took marathon surgery of almost 10 hours to repair Giuseppe's body.
Pelvis was one doctor with his own teams. Then there was the spinal surgery with his own team. Then the surgery for the humerus and the collarbone was another team. Amazing, amazing job they did in 8 hours, 10 hours, and coordinating all this stuff.
Giuseppe's injuries and intense rehabilitation mean he's been forced to give up cycling and work for now.
You know, I'm an architect, I do projects. I abandon all projects. My project is only me right now to get fit.
With partner Vina by his side, Giuseppe is working hard to move forward with a new perspective on life.
Beautiful sun, huh?
Yeah.
Beautiful day. Yes, it is. Life's changing. You start to think about what is important and what is not important.